Well, thanks so much for watching Making AI Work for You, Transforming Healthcare Through AI. As you may have noticed, if you are a fan of our other show, Making Healthcare Work for You, this is a new series that we're taking, a spin on AI. So we're talking about how to make AI in healthcare work. With that, we are launching this series with, I'm Stephanie Fields. My co-host, of course, is Dr. Apoorv Gupta. And today we are welcoming both Dr. Robert Pearl and Sherri Douville. And so if you don't know anything about me, I'm a patient and family advocate. Much of my experience has been shaped by my own personal experience, advocating for myself through a high-risk pregnancy, my daughter's NICU stay, and some other things. And then also I have a lot of experience in philanthropy and certainly communication and hosting with my background in TV news. So with that, I'm turning to Dr. Robert Pearl. Dr. Robert Pearl is a renowned physician, former CEO of the Permanente Medical Group, professor at Stanford University Schools of Medicine and Business, as well as author, podcast host, and everything else in between. His most recent book, ChatGPT MD, was co-written with ChatGPT. And so that was something that we really loved and we talked about on our last interview with you. And we love your passion for healthcare, AI, all the things, and how to drive it forward. And so we are also welcoming Sherri Douville. Sherri Douville is the CEO of Medigram, as well as the chair of the Trustworthy Technology and Innovation Consortium, the TTIC for short. She's a recognized visionary leader fusing healthcare technology and blending AI, cybersecurity, and clinical governance to shape the future of healthcare. Her transformative leadership has made her a respected authority in the healthcare technology landscape, where she focuses on building teams and solutions that deliver to the quadruple aim with speed and scale. Sherri is a series editor for Taylor and Francis, and she additionally has edited and co-authored a series of books that have defined the field of healthcare tech and IT. And then, of course, we turn to my favorite co-host, Dr. Apoorv Gupta. We have been doing Making Healthcare Work for You together for nearly 4 years. He is a vice president at Premier. He's co-chair of the TTIC with Sherri. With a background in medicine and healthcare management, Dr. Gupta is dedicated to improving healthcare systems through data-driven insights, cutting-edge technology. He's a thought leader in healthcare innovation, particularly in the areas of value-based care and clinical governance. And he is a wonderful co-host. So I'm so happy to have this conversation with all of you and talk about how we can use healthcare and AI to drive healthcare transformation. And both of you come at this from totally different angles, but both with the same goal. This is a necessary part of healthcare. We need to have technology. We need to use AI. We need to embrace it. To Dr. Pearl's point in the past, we can't resist it because you'll just be left behind. And to Sherri's point, I know nothing matters more to you than the safety, the ethics, the quality, and governance of all of this. So with that, where do these two worlds intersect? How do we start? Because there are so many things to manage, and it seems virtually impossible to get them together on the same page, but we know it's possible.
Yeah, happy to jump in, Stephanie. Thank you for such a generous and kind introduction. I had to pinch myself to be able to be engaged in this discussion with this extraordinary panel. So thank you so much. So our vision at Medigram, which helps lead the TTIC, is that AI will and should have a transformative impact on healthcare. But like all of AI, it has to be done the right way instead of, recklessly. And so the bias I bring to it is I did spend a decade at Johnson & Johnson in a dozen disease states, and that's how I grew up professionally. And so the one thing I'd point out today, because it's so timely, is that the Attorney General in Texas issued a statement about a settlement with the healthcare Gen AI company. And it just underscored, the misalignments that we have to actually, close the gaps between healthcare and tech in the technology fields. And so the conversation with the leadership team at TTIC was about how medical devices and pharma are regulated full life cycle, including marketing. Whereas with tech, we don't have any regulation at all, including the full life cycle. I mean, there's some light regulation, but in general, it's very lightly regulated and no marketing regulation. And so the claims and the complaint from the Attorney General had to do with what we call false claims in the life sciences sector. And so that's why, Apoorv and the group and I have been working diligently to provide, industry leaders who we call CEOs of IT, the tools to really govern and manage these advanced technologies.
As you know, in my book, ChatGPT MD, that you referenced earlier with all profits going to Doctors Without Borders, I look at the question of what is AI, and I make the point that we should stop talking about AI because there are different kinds of AI.
Mhm.
There is narrow AI where you take 10,000 mammograms, 5,000 of which show cancer, 5,000 of which are either normal or have benign disease. And then the AI technology analyzes these two data sets, finds 50, 60, 100 different slight variations, assigns a probability factor, and gives you a tool to use. That actually is highly regulated. It requires FDA approval. There's 650 or so right now programs done. And my belief is those will be minor tools and have minimal impact. Big opportunity, and that's ever since November 30th of 2022, is generative AI. A completely different technology. It doesn't start with any data sets. It starts with everything on the internet, every textbook, every medical journal article, every piece of information that's available. It then transforms it. Certain things are more relevant, those things that are published recently as opposed to older ones, peer-reviewed versus non-peer-reviewed, out of university settings as opposed to single individuals in the community. And then it out of that can generate an answer to every question. I don't think it's regulatable. And the reason is it's like the telephone. I can't, if you're talking to a friend on a telephone, the telephone company can't stop you from giving bad advice, from asking inappropriate questions, or at least it's very difficult to do all of that. Generative AI has the same capability. Today, you can go online and you can ask a question. In fact, 1 in 6 Americans already are doing that. And how do you regulate them from asking the questions? Now, if the question is, will the technology explode? Is there security and privacy that Sherri deals with a lot? Yeah, those kinds of things can be regulated. But the content of an infinite amount of questions and answers that can be provided are not there. What we really need to have is we need to have education, help patients understand, how do you ask the right question? How do you prompt it? How do you follow up upon it? How do you use it? But I think the bigger question is application inside medicine. And I want to differentiate right now two parts. There's what I call the administrative side, where it's having massive advances right now. You know, for a long time, I get calls from companies, AI, so-called AI companies. They said, we have this great tool that will do electronic health record. It saves doctors 2 to 3 hours a day, and no one's buying it. What's the marketing problem? And so the problem is, it doesn't save 2 to 3 hours a day. Maybe it does in your demo, but if it did, you'd have a line out your door. You wouldn't have to worry about selling that. That's what we have today. And there's 6 or 7, maybe a dozen more companies who are doing it. Very well done. And physicians now are taking the eye off the screen, able to look at the patient, and the records are better than they would have been before. So I don't want to minimize the administrative side, but I think the really important side, to the point you're making, is how do we use it to transform American medicine? And I always start with chronic disease. And chronic disease, hypertension, diabetes. Why do I start there? Because according to the CDC, if we could manage chronic disease, both prevent and have good medications, well received and well taken around it, things that we know will work, we could diminish heart attack, strokes, kidney failure, cancer by 30 to 50%. Now I want you to think about, what would a healthcare system be like if we had 30 to 50% fewer heart attacks, strokes, kidney failures, and cancers? It would be affordable. People would live longer. We wouldn't have the problems that are there. Now, why do we not do that today? And I'll say in my book, I talk about 2 things. Doctors will not do anything that slows them down or cuts their income. And those 2 things are what the fundamental problem is, because the current system doesn't reward better management of chronic disease. You make a lot more money unblocking a coronary artery than stopping from occlude in the first place. And so if you ask me, what are the biggest challenges? We know how to use a generative AI tool, or soon you will, using so-called plugins, really GPTs, to be able to connect the technology to wearable devices. My colleagues at Stanford Engineering School have inexpensive, 99.9% reliable things that can measure blood pressure, pulse, blood glucose, blood oxygen, and we don't use them. We should. We should be able to control hypertension 95% of the time. We control it 55% of the time. Diabetes, we control a third of the time, because this tool can help patients understand how they're doing. It can follow those monitors, provide the information, It can notify the clinician when medications need to be changed at 1 month, not at 4 months, or not at 8 months or a year. We could do that. And that's just one small piece of the kinds of things that I see generative AI being able to do. If we could do that, however, the challenge is we're in a fee-for-service world, and doctors and hospitals make a lot less money. So we need to make a second change, which is moving from a fee-for-service, they pay for volume reimbursement, to a capitated one. And not capitated at the insurance level, but at the delivery system level. And now you align the incentives. Prevent disease, you do better, your patients do better. Better manage chronic disease, you do better, your patients do better. Be able to avoid medical errors, you do better, your patients do better. Everything aligns. And to me, that's the big opportunity. And it's just a privilege to be on the show, because I'm hoping that the people from the various health systems listening in, viewing in, are going to be able to make these changes happen, both implementing the technology that I actually think will be the easier half, and being able to make the change in how the reimbursement occurs and reorganizing around that, which I think will require tremendous leadership.
Wow, that's quite an opening salvo from both of you. I am feeling so excited. I'm like thinking of jumping out of my chair because I absolutely love that. Dr. Pearl, we've heard you a couple of times. We're big fans. Thank you for so much for that message, which I think really paints a really important picture of where AI and a specific kind of AI can be used. You know, you're telling us that this could become a super advanced population health tool, and if applied properly, it could, you know, completely transform the way we are delivering care and receiving care. I really love that. And then you've also laid out a couple of barriers. One additional barrier that is coming up in my mind, I'd love to get your take on, is what about the trust factor? Is one of the reasons why we're not using the tools that are already available and already reliable because we're not sure we trust the answers that are coming out of the tool?
Two thoughts. The first one is we shouldn't yet be using it in the way that I'm saying, because it's not yet there, but it's so close. Remember, this is doubling in power every year. By 5 years from now, it's going to be 32 times more powerful. By a decade, 1,000 times more powerful. That's like your car going as fast as an airplane 5 years from now and a rocket ship in a decade. So I know that we're going to get there. But you're right, at this point, but as I said, 1 in 6 patients, the majority of physicians, more than half of physicians, are using it in their office. So this is not, you know, something that no one trusts. It's a progressive problem that's going there. And when we look at the data, we compare the technology. It's been done against the national exam, the qualifying exam for physicians, and it scores in the top 10%. It's been used on complex questions measuring against attending physicians in Boston at a major academic center, and it does better than those clinicians. No, I think that, you know, to me, I'm always looking at the first derivative. Not where we are today, but where are we moving? Where are we going to be in the near future? Don't get ready for, you know, what's the famous hockey players say? Don't go where the puck is now, go where the puck's going to be. You know, we know where it's going to be. 3 to 5 years from now, these issues will be behind us. The question's going to be, how do we evolve the system of care? Because even if you wanted to use this effectively, you can do that, but you can't get the reimbursement for it. You can't get reimbursed for the time. And right now, what's happening with clinicians? They're running faster and faster and faster on the treadmill. They're getting exhausted. Burnout is 50% of doctors. The satisfaction is growing. 70,000 physicians left the profession last year. There's no time. And that's why I think that it's two hands clapping at once. One's the technology. It's got to advance. We got to figure out how to use it. We need to be able to train patients around it. There's a whole bunch of pieces that need to happen. Those steps, I think, are no different than a lot of other technology that we have successfully implemented. At the same time, with the other hand, we got to be looking at how do we change the fundamentals of the medical healthcare system? How do we reward keeping people healthy, preventing disease, better managing chronic disease so that we minimize complications? And then what are we going to do about the entire workforce? Because then rather than having a deficiency as we think we have today, we could end up with a surplus of clinicians. And how do we use that to more maximize health? How do we create a virtuous cycle rather than getting stuck where we're at right now, languishing in a vicious cycle?
Sherri, you live in a world with technologists. people who are at the top of their field working on this and trying to handle the privacy and security and ethics behind all of this. But to Dr. Pearl's point, it's impossible to regulate some of this because people are on there using it. And then you have people in technology using it who are early adopters and want to use this and be on the forefront. So how do you handle trying to get this responsibly implemented in the places that it needs to make a true impact, rather than just having a bunch of people basically running wild with all of their healthcare data that isn't usable or could potentially even be damaging if it's not ethically and responsibly handled to make this safe for everybody? It's a huge job, especially when everybody's out there running, trying to do it before it maybe has been tested.
Yeah, I love that question, and I love the inputs of Dr. Pearl and Dr. Gupta as well, and we're in complete perfect alignment. And just so you know, Dr. Pearl, we absolutely do not advocate for any type of regulation necessarily, because we just don't think that that's practical given economics. And so we're completely aligned. What we do at TTIC, which is led by Medigram, is work to really identify and empower the most strategic leaders in the industry as well as in each organization or facility, because the challenge that you alluded to is that Gen AI is, and I believe this as well, going to continue accelerating. And I'm actually a heavy user of AI, and the way I'm using it changes every week. And so we are in complete alignment in terms of the vision and where it's going. The challenge is, what does that mean for the health system from a quality perspective, from a safety perspective, and from a liability perspective? And so our perspective is that we really need to be training like super users who are, when I say super users, who have the self capability to govern the way that they use the technology. Because as a user, the way I govern my use, because I bind our organizations to medical ethics, which is the only way we see physician leaders of all kinds, including quality leaders, really buying into technology. And so through self-governance that's aligned with medical ethics, I'm constantly governing the way that I use AI. And also I argue with it a lot, especially when it's wrong or it's factually incorrect. And so not everybody is comfortable with it enough to be able to sort of duke it out with the AI the way that I am increasingly with all the different versions of AIs. And so what I would say in terms of, just looking at the most strategic, gifted leaders in the field really taking responsibility for how are they going to leverage this amazing tool to really execute on this transformation and inflection point we really do have. So Perv and I were just chatting about, the fact that the economics, people that weren't talking about value-based care even 6 months ago are all of a sudden very, very keen on talking about, how the technology plans fit into that. And so it really is the right time, but it also has to be done with the right people who can be what I consider like SEAL teams. So I think that's the answer to you, Stephanie, is that our consortium is working on identifying and building the SEAL teams that can work through all of the issues. And our foundational, sort of launching pad is that I got to be part of the award-winning IEEE standard development working group, which is a full stack technical standard. And what it does is it ties the business of value-based care to technology management for the whole stack. So medical devices, back-end databases, networking, interoperability, and data security. And so using that as a launching pad, because it consolidates bureaucracy and reduces and harmonizes multiple standards, as well as ties it to the business of value-based care, that we're using that to help these SEAL teams of top industry leaders leverage technology to deliver today and smoothly make that transition to value-based care tomorrow.
I'm just kind of amazed again at where the convergence of some of this is. What I'm hearing from you, Sherri, is as you're trying to create this SEAL team and going around the country, working with top leaders, you're seeing the emergence of interest in value-based care. This is what Dr. Pearl is saying has to happen. And yet we're dealing with, probably 15, 20 years, at least trying to make value-based care happen. Through regulatory policy frameworks and advocacy and other such, and made some progress. And I guess we won't debate that point of where we are with value-based care, but let's take it as a given that that's what's needed. in order to enable this. Is the AI, generative AI or other related AI, is that what's going to take to drive the value-based care process forward? Is it going to happen at the national level? Is this going to be some sort of a local community-based ecosystem that ultimately starts experimenting with this? So maybe Dr. Pearl, you can comment on that first, and then we'll have Sherri as well on that, please.
I think it's the reverse set of questions that you just mentioned. Doesn't start with the tool. The tool, let me back up a little bit. In 2015, I wrote my book Mistreated about this problems in the system of healthcare. And then in 2018, I wrote a book called Uncaring about the culture. And both of these, I think, were very accurate. The system is broken, resembles 19th century cottage industry. It's fragmented, uses technology from the last century. It's paid on a piecemeal basis. We go through the systematic problems. And the culture of medicine is one that often is 20 years in the past, not the medical knowledge, but the culture about how we treat patients and what the proper way to provide care is going to be. And the systems change very, very slowly. And out of that, no change happened. And fundamental across this entire time, it required, I think, that we change the way we pay for care. Charlie Munger used to say, tell me your incentives and I'll tell you the outcomes you're going to get. Pay people based upon volume, and you're going to get a lot of volume because that's what we've said is important. So I think we need to make that change. And when I look back at why has so little progress happened and why did I get so excited, as you say, write the book with ChatGPT, it was because in 2022, we finally had a potential solution. I could see it then. Now you move forward now 18 months, it's obvious to everyone. What is going on? We now have a tool that's going to allow us to be able to manage chronic disease. So what's going to drive the change? I think it's going to come from people getting exhausted. Right now, today, when I talk to small business owners, they can't afford healthcare. It's going to go up 7 to 8% on average, which means that since Medicare is not going to go up very much because we have a limitation on what that can go up in cost, and we know that the large purchasers will find a way to ratchet down the insurers, who's going to pay the price? Small businesses. And they can't. They are facing higher employment costs. They're facing problems with their suppliers. They have all these issues, so they're going to demand it. Clinicians, as I said, are exhausted. They're burned out. They're going to look for a different solution. Hospitals, half of them are struggling right now. How do we think about this as a confluence of forces? Because it makes such logical sense. Take someone with hypertension. I see you, I diagnose hypertension, I give you a medication, and I say, I'll see you again in 4 months. When you come back in 4 months, your blood pressure is still elevated. I say, white coat syndrome, I'll see you in 4 more months. 8 months for a problem that accounts for 40% of strokes. How do we justify that? We give you a monitor 3 times a day. It measures your blood pressure. You got 100 readings. 92 are normal, 8 are abnormal. Are you doing great because 92 are normal? Are you doing terribly because 8 of them are abnormal? As a patient, you have no idea. And I don't know a single clinician who wants 100 blood pressure readings mailed to the office or a phone call sent to the office. We want a technology that can analyze it. For a computer technology, analyzing 100 data points, establishing a trend, making a prediction of where we're going is one of the simplest calculations it could be asked to do. There's still going to be things that we have to see patients in person for. Physical exam to be done, fuller history to be taken than we might otherwise be able to obtain. But how do we then be able to eliminate a lot of the things that we're doing now, focus on the areas of the greatest impact, and as a consequence of that, be able to work less, keep people healthier, and as a result, preserve the economics. That is the resting point. And if we can get there, this will accelerate rapidly. I predict it will happen in some geography, some medical group, some business, some society. It'll be tried, it will go well, and then it'll just expand out from there. And by a decade from now, we'll look back and say, oh my gosh, how do we ever use that antiquated system of the past?
So let me just tie it back to our previous conversation, and I love the vision you outlined. So we had talked about autonomous vehicles, and my comment about it is that it's a great idea and a great vision, but if it's not implemented well, you lose the trust of consumers and regulators the way it happened with one famous car company that had these disastrous safety issues. and then it tanked their stock price by half. And so our whole motivation is about how can we make sure that as an industry we self-govern that so that the technology is used productively and well. So a small, simple example is everything you said, we all want that same thing. But if somebody has a pre-existing condition and they get discriminated against because that data had leaked and wasn't protected, nobody wants that for any of their family members or friends. So those are the kinds of things that really we're working to make sure get done well and get done right. And so what I would love from you is just your commitment to, as much as you are advocating, which I all agree with and we love, for value-based care, for patient-centered care, for empowering patients, that to also add that as much as we want to improve clinical quality, that has to be done with technology quality. That's really what we wanted to talk to you about and see if we could ask you to add that to your platform, because you just have such an incredibly important, influential, well-respected voice. So what do you think about that ask, Dr. Pearl?
So my book has 5 parts. And an entire one of the 5 is exactly about the problems that you described. I talk about security, I talk about privacy, I talk about misinformation, I talk about all the challenges that are out there. The one thing that I will say, though, and again, it's why I differentiate the different kinds of AI, but specifically the generative AI, is I actually think it's important for people to recognize that the risks from it are no greater and in many areas less than the ones that currently exist. So you can't do a generative AI solution without having an electronic health record in a physician's office. At least you can't create the data without having the electronic health record. Mm-hmm. I think that electronic health record is far more penetrable when it comes to security breaches that are there. If you're going to go to Amazon today, your privacy not only is not being protected adequately, it's being sold. That's the business model. That's exactly how they make their money. All right.
Exactly.
So far, at least, generative AI is in a subscription model. It's going to be less likely to do that. Misinformation, it's a lot easier to create a whole bunch of links to articles that don't really exist, to create links into things that say vaccines harm you rather than saving millions and millions of lives every year around the globe. Whenever you have a generative AI tool, you have the opportunity, at least, to be able to access the literature on discrimination. I mean, as you say, the Optum one is a great example from several years ago. You know, for the listeners who may not be familiar, basically, United Healthcare, the Optum's part of United Healthcare, wanted to find the sickest people so they could add more resources. They had great motivation. They went into their data files and they selected the individuals, and something like about 15% of the people selected were Black patients. Other people went in there, looked at the same data, and said it should have been 50%. What went on? Headlines scream that the computer's applications, the AI, is discriminatory. No. Physicians prescribe and provide $1,800 less medical care to Black patients and white patients with the same degree of disease. And what was really happening is it was just duplicating what clinicians would do. It didn't make discrimination worse. It just didn't make it any better. Now, it's fascinating. If you take a generative AI application and you give it 2 different prompts, one prompt you say is, what would a 40-year-old white physician recommend to this Black patient who's having chest pain? And now, instead of that, you just say, what would a 40-year-old physician recommend to a patient with chest pain, with this degree of chest pain? You're going to get different answers. Your first question asked, what would a discriminating, biased physician do? And your second question, even if you do more and say who wants to have equality of care, you're going to get a different answer. I think there's an educational piece that we have to understand. How do we educate clinicians and how do we educate patients? And I would really encourage organizations like your own to create these tools. Why should everyone have to learn how to prompt a generative AI application? Why should they have to learn how to minimize the degree of inequity created as a result of that? I think we could create the tools, make them readily available, make them free to all doctors, to all patients. It could be done for an insignificant amount of money in the budgets that we have. And having done that, I think that we could advance this very, very quickly. So that's my answer back to you. I'm very concerned. I've written a lot about security and privacy and misinformation. To say 20% of my entire book is about the negative and problematic aspects of it. But having said all of that, I think that we need to have the same discipline to generative AI that we have to EHRs, that we have to laboratory results, that we have to computers overall, that we have to finance, that we have to all the pieces that are there. And we have to really help educate the American populace and the clinician providers about the ways that they can minimize these risks. They can't be made totally to go away. That's just the nature of computers, but we can minimize them over what otherwise would exist.
That leads into my next question, and it's for both of you. So whoever wants to take it first, but you both in your own ways have said clearly and in other conversations that education is important. It's education in the people who are creating this technology about what's responsible and ethical. And then it's education, Dr. Pearl, on your end for both how doctors should be using this for their patients, but also for their patients themselves. So what do you each think the most important piece of that education is? What if, because ChatGPT can run wild and anything's possible on there. So what is the one thing that you would say, okay, doctors, your first go-to is this, patients need to know this, and technologists, you need to know this? Where do they start in terms of education?
That's a great question, Stephanie. And I'm going to transition over to Apurv in a moment because he and I are working in a dyad model where he promotes performance improvement and clinical excellence, and I'm representing technical and regulatory excellence. And so we believe jointly that it's about empowering, just like Dr. Pearl said, the industry leaders with tools. And so we've written several blogs that do exactly what you called for, Dr. Pearl. So I think you'll be happy to know that they exist. But we've outlined a complete roadmap for healthcare technology leaders to be able to build, design, and monitor things like bias. And the reason why it's important is because you're right that it only reflects original human behavior. But the challenge is that because like I 10x myself using AI, I'll just be honest with you, and that's only going to accelerate as I create more different agents to do different kinds of workflows that I do. But at the same time, again, being committed to medical ethics, I also have to make sure that I'm not accelerating anything that's negative. And because it's such an accelerant, it's the acceleration of that of what's not our better nature that it is that the industry leaders are very interested in taking a very proactive approach in what is their role in overseeing and governing that. And so Apurv was instrumental in helping us, design this framework, which a lot of it we will be making freely available to the degree that people that it fits their capability to use it. So Apurv, do you want to say a little bit more about the system that you helped to invent, leveraging model cards?
Yeah, well, I mean, I guess I'm humbled to make that word, but I guess I'll just say it very briefly. From my experience and the kind of culture transformation we try to drive, we're trying to leverage the best practices and principles that we're learning from these worlds, combined with Sherri, all your great experience and the vision that you have. And so we're really trying to leverage the tools, performance improvement tools, something like a model card that we're borrowing from the industry that might be able to give a little bit more than a black box view into what's happening with the AI tool itself. So trying to use performance improvement tools and systems in that thinking, trying to think about the leadership. It's a little bit more of the meta opportunity. What is the governance that goes around the system? That's really where we're trying to bring in. But and a segue to Dr. Pearl, I guess what I've been wondering about as I've been hearing this conversation is all of that really outdated, considering how fast the industry is changing, considering what the different capabilities of ChatGPT are and what they're going to be. Are we even going to be able to measure quality in a way that is even comparable to what we're thinking of today, to even know what is effective? So I guess with that, I'll just turn it over to you, Dr. Pearl. How do we from the industry struggle to keep up, even in our best intentions or perhaps our naive intentions, to make sure that whatever we're trying to bring into healthcare is truly transformative rather than damaging?
Let me start by saying that today we consider high quality what we tell a patient. Did we give the patient the right information, make the right diagnosis? I think in the future, quality will be measured by did we get the right outcome? And within that, it's easy to tell. How many patients had heart attacks last year? How many patients with diabetes have good control? So the opportunity to be able to determine outcomes actually, I think, becomes better and easier, particularly as we have EHRs. And we don't have the time to talk about it right now, but the opportunity to open the application processing interfaces, the APIs, and make them interconnected everywhere is a major piece that should be there, and the government should actually take far more action than it has to date. That's a different conversation than we're having right now. So let me say that that's the outcome. And the question is what stands in the way? And I would differentiate various parts of what stands in the way. One of the big pieces is that this change is going to be scary. We're talking about people's income. We're talking about people's self-identity. We're talking about harm to patients. It requires leadership. And we don't have the leadership that we need. It's why I teach both in the medical school and in the business school, and have people on both sides of the driveway sharing with each other as part of that particular process. And in the book, another fifth of the book is about leadership. And it's the A to G model that I use about an aspirational vision, the behaviors, the context, the data, the engagement of the leaders, the faculty, and the incentives that are sitting in place. So not enough time today to talk about all that. But leadership is going to be essential to move people along. But moving people along is not enough. You have to also educate them, give them expertise. If we have a new operation, we have courses on new operation. We need to have courses on how to use generative AI in order to be able to improve chronic disease in a way to be able to save lives. We can save hundreds of thousands of lives. We have 400,000 people who die in the United States every year from misdiagnoses. Another 400,000 who are disabled as a consequence. 250,000 people who die from preventable medical errors. Probably 500,000 people from poor control and prevention of chronic disease, diabetes, hypertension, and so forth. We have a lot of opportunities. I think what should be different this time is I'll say we should make it for free. Obviously, someone's going to pay. But in the end, I think at the end user place, it should be free. It should be easy to use, teaching people how to use this tool. Because the thing about technology is once you know how to use it, it's simple. But until you figure that out, it seems like a massive hurdle. It's like mathematics. Once you understand how to do an algebra equation or a calculus problem, they're simple. But learning it can seem like a massive, impossible to get over hurdle. So we need to facilitate, support people in that process. And we have to educate patients as well. And we have to do it in a way where it's not overly burdensome. If every doctor has to train every patient for an hour, it's never going to happen. But if there's an online tool, if there's a video, if there's an easy way for patients to get that information, it's simple for me to tell the patient to go there, to give them the link, to put them together. So I think that we need to have something that is very different, somewhat similar to when we wanted to have a vaccine against COVID, and we had a Operation Warp Speed. I think we need an Operation Warp Speed to be able to use generative AI, to be able to control chronic disease, to be able to avoid preventable deaths. And we need to do that in a way that is affordable for the American populace, for the providers of the care, and then we need to trust them. And I think that's something else. I trust patients. I think they want to get better. I think we haven't given them as much help as they need. I trust clinicians. We just haven't done the things that we need to support them in their efforts. I think we haven't done the things that are necessary. We tend to blame people. And I think that this is going to require a very different mindset. I'm optimistic that we finally have the tool. I think we will get there. I just don't want to see us waiting a decade. I recently wrote about the possibility in socioeconomically challenged communities. I'm very worried about the inequities in healthcare. And how do we create what I call community hubs with 10 community workers capable of teaching people about generative AI, about showing them how to use monitoring in order to be able to better manage chronic disease. Maybe with one clinician if there should be a major medical problem that develops. And maybe you could have 10 of these hubs with a few specialists who are supporting the primary care physician or the primary care nurse practitioner in each of these hubs. We could deliver care for $1 million a hub, $10 million for 10 large hubs supporting 10 major communities for 0.0001 or whatever else. And let me add one more piece, if I could, about the future. If you ask me the question, what is the greatest threat to generative AI? I think the greatest threat to generative AI is it's going to run out of data to analyze. And we're seeing that right now in the overall internet. They don't have to worry about medicine. We create every year a petabyte of medical information. That's a 10 with 14 zeros off of the monitors and the machines in hospitals right now, of which we discard 97%. Imagine if we had all that data and we could analyze it. We could answer questions in a weekend that would take researchers years to be able to figure out. We have an opportunity ahead of us that is so massive. It's just not going to happen if, number one, we don't do what Sherri talks about to make sure people can trust it because it's safe and protective and secure. And number two, if we don't take the steps to educate people, to support people, to provide the courage to them, to make this change that's necessary to align what's in the best interest of our nation, the providers of care, and the recipients of care. I think generative AI is a great tool and one that I'm hopeful we will put our arms around. And as I say in the title of my book, I say how AI empowered patients first, and then clinicians, and then doctors can take back control of American medicine. We've lost it so far. We now have the opportunity to regain that. And I want to thank you for having us today. And thanks, Sherri, for focusing on the opportunities to keep it safe and trustworthy. Because if it's not those things that she said, we're not going to use it. But I believe that we can make it as such. And I'm optimistic that we will. So thank you so much.
Remarkable. That was fantastic. And I love your point about the community teachings. I was thinking that, and then you said it. I thought, gosh, they should partner with people in the communities who could spread this word. And I love that you said that. And I have to say, I never in a million years thought that the threat to generative AI would have been a lack of data. So that was also a remarkable point. Thank you both for being here. This was a fantastic conversation. I really, really loved all of the things that you shared with us today.
Just
Our pleasure.
really an honor. Thank you. Thank you for being a wonderful host, Stephanie, and the Pearl host team. And thank you, Dr. Pearl. It's an honor to dialogue with you.
Nice to meet you, Sherri.
And thank you all for watching. And if you would love to partner with us and be part of this mission, align your brand with it, we welcome you to become a partner with us on making AI work. We need all of the minds, and we're featuring the brightest ones in healthcare tech and innovation here. So welcome you to join us. We'll talk to you soon. Bye-bye.